The male reproductive system is more complex than some may think. The male reproductive system has many organs and hormones that allow for fetal development to occur. Along with the maintaining of homeostasis, there are many contagious, genetic, and cancerous diseases that can be prevented by proper sex education and sex safety. Today, we will begin by discussing with this system's anatomy.
This is the male reproductive system up close. Sperm production begins in the testes and will travel through the rest of the reproductive organs through the vas deferens. The testes are where sperm and testosterone production takes place, in a coiled structure called seminiferous tubules. The epididymis is where sperm mature and are stored. This is also where the sperm develop their flagellum, or tail, which gives the sperm their ability to swim. Once the penis fills with blood and becomes erect, mature sperm head up the vas deferens. Sperm is able to move up the vas deferens with smooth muscle contractions. The sperm arrive first at the ampulla, just above the prostate gland. Here, secretions from the seminal vesicle are added. Next, the sperm will be propelled forward through the ejaculatory ducts toward the urethra. This is where the prostate fluid is added to create semen. The semen is then ejaculated through the penis by the urethra.
When we think of homeostasis, we rarely or never think about how the male reproductive system helps in maintaining homeostasis. However, it can help in maintaining homeostasis in various ways. The muscles of the scrotum help in maintaining homeostasis by regulating the temperature of the testes that need to be kept cooler than the normal body temperature in order to produce sperm. Second, testicles produce testosterone, which is an essential part of puberty in males, because it stimulates the production of sperm and it also allows for emotional and mental well-being of the person. The penis helps in maintaining homeostasis by taking part in the urinary system by providing a way to get rid of urine from the human body. The male reproductive system is truly an essential body system due to the fact that its main purpose is to reproduce. Every single organ found in the male reproductive system have a different function, but eventually their purpose revolves around the production, the maintenance, and the transportation of sperm and semen to discharge sperm within the female reproductive tract during sexual intercourse. Every single system, organ, tissue, and cell found in the human body function for their ultimate goal, and that is the survival of the individual by maintaining homeostasis. Only the reproductive systems have a different, a longer range, and in no doubt a more important function, and that is the survival of the human species.
We will now be discussing 5 of the disorders that occur in the male reproductive system. Cryptorchidism is a congenital condition in which male infants are born with a testis or their testes stuck in their abdomen. There are many causes for cryptorchidism, but the most common is when they're born prematurely, so they weren't given enough chance for their testicles to actually descend. The signs consist of not feeling a testes or seeing a testes in the scrotum, and swollen groin lymph nodes are also common as well. There are no correlating symptoms, so every infant will react a different way. Cryptorchidism can result in permanent infertility and also testicular cancer. There are 2 types of treatment: hormonal therapy, which just allows testosterone to be produced, which will let the testes descend naturally, or there's invasive surgery that can permanently move the testis into the scrotum. Cryptorchidism, fortunately, is not hereditary, but sadly, there is no preventative measures to it. It just happens by chance.
Testicular cancer is a condition where cells start growing uncontrollably in 1 or 2 of the testicles. The cause of testicular cancer is not known. However, the sole risk factor that is linked to this type of cancer is undescended testes. Testicular cancer is very rare, since there are less than 20,000 cases in the US per year. Signs and symptoms include a feeling of heaviness in the scrotum and a lump on one or two of the testicles. It can be diagnosed by the use of ultrasound, by performing blood tests, or by surgically removing the testicles. This can have a huge impact on the patient, both physically and psychologically. It can make the person infertile and cause cognitive dysfunction. This can be treated by radiation therapy, chemotherapy, or by surgery. The survival rate of testicular cancer is 95%. And in order to prevent testicular cancer, specialists recommend to take good care of the general health of the human body.
Prostate cancer occurs when cells grow rapidly on the prostate gland. This disease is more common with African American males or males over the age of 65. There is no direct cause like with most cancers. However, genetics, a poor diet, and obesity can increase your risk. Fortunately, this disease is curable, but it is a growing problem in the United States. Organizations such as Zero and the American Cancer Society are dedicated to putting an end to prostate cancer and also other cancers. Prostate cancer can be prevented if people just take precautionary measures, and by raising awareness, fatalities can be reduced.
Phimosis is a condition in which the foreskin at the head of the penis becomes too tight to be retracted off the head of the penis, causing discomfort and infection. It is usually caused by aging, scarring, medical conditions like diabetes, and infection. Luckily, no laboratory tests are needed, meaning diagnosis is strictly clinical. It just takes a doctor's physical exam to diagnose the patient. There are 3 treatment options. The first one is waiting and seeing if the phimosis resolves on its own. The second is a topical steroid cream. The third is a circumcision of the penis. There are some preventive measures you can take, including the circumcision of the penis and good self-hygiene skills, to ensure the penis will not become infected.
Epididymitis is an infection causing the epididymis, which in most cases is contracted through STDs, but sometimes can also be contracted through incorrect catheterization, trauma, and surgery. The best and most effective way to prevent the contraction of STDs and epididymitis is to practice safe sex. This infection is most common in male adults ages 20 to 39. It affects 200,000 men a year. Symptoms include testicle pain or tenderness, painful/urgent urination, and low abdominal pain. Signs include red swollen scrotum, discharge from penis, and blood and semen. The suggested treatment for epididymitis caused by an STD is doxycycline.
Sex education is a very undiscussed topic among families and schools in the United States. Schools do a very poor job at teaching students the necessary topics of sex education, and when it is discussed, it is looked at as a joke. In families, it can be a very uncomfortable topic, but this needs to change. I mean, we don't want to end up like this.
I don't know if you're gay. Why does my penis grow in the morning? Why don't I have a penis?
Yeah, so that's why we need to be teaching our children good sex education. At ages 3 to 5, families should be teaching their children good self-hygiene. This could mean properly washing hands and wiping after using the restroom. They should also be learning about both sexes at this age. At ages 7 to 9, parents need to be teaching their children about body changes like puberty, masturbation, wet dreams, and the LGBT community. At ages 12 to 14, parents need to be having a more in-depth conversation about sex, consent, pregnancy, STDs, and protection. At ages 16 to 18, parents need to have an important conversation about consent, rape, sex safety, and STDs, especially while going into their college years.
Parents do not have the only role in teaching their kids sexual education. Children in schools should be taking the initiative too. No, children, this does not mean watching porn. Schools should offer free condoms and appropriate feminine products. They should also offer yearly sex talks with certified sexual educational specialists. Free lunch is now being offered, so why not offer free STD testing, pregnancy tests, and sex talks? Forms of male contraceptives do not only pertain to condoms, but also include spermicide, vasectomy, pull-out method, and last but not least, abstinence. Spermicide is a jelly which females insert into their vaginas to block the sperm from entering the cervix. A vasectomy is a surgical procedure in which the small tubes located in the scrotum, which produce sperm, are cut off or blocked off in order to prevent pregnancy. The least effective form of preventing pregnancy is the pull-out method. The most effective way of preventing pregnancy, though, is abstinence,
which is no sex at all.
Disgusting!
My name is Erin McCatton, and you just watched The Male Reproductive System.